Video knowledge. We learn, we shoot, we show. Metabolism. Biotransformation. This is the conversion of drugs into metabolites, which may be active or inactive. The liver is the primary site for drug metabolism, and various factors can influence this process, including age, genetics, and interactions with other drugs. Phase 1 and Phase 2 reactions. Phase 1 involves modifying the chemical structure of the drug, while Phase 2 involves conjugation with other substances to enhance water solubility for excretion. 1. Definition of biotransformation. Biotransformation refers to the chemical alteration of a drug within the body. This process is crucial for converting pharmacologically active substances into forms that can be readily eliminated from the body. 2. Sites of biotransformation. The liver is the primary site for drug metabolism, but it's not the only one. Other significant sites include the gastrointestinal tract, lungs, plasma, and kidneys. Each of these organs contributes to the overall biotransformation process, ensuring that drugs are adequately processed. 3. Potential outcomes of biotransformation. The outcomes of biotransformation can vary considerably. Prodrug activation. Some medications are administered in an inactive form and require metabolic conversion to become active. For instance, the inactive prodrug must be metabolized by the liver for effective therapeutic action. Conversion to another active metabolite. Certain drugs produce active metabolites that can have therapeutic effects. A classic example is diazepam, which is metabolized into oxazepam. Similarly, codeine is converted into norcodeine and morphine, demonstrating the complexity of drug metabolism. Conversion to a toxic metabolite. Not all metabolic processes are beneficial. For instance, meperidine is converted to normeperidine, which can be toxic, highlighting the potential dangers of drug metabolism. Inactivation of the drug. Lastly, the metabolism can render a drug inactive, a crucial step in terminating its action within the body. 4. Factors affecting biotransformation. Numerous factors influence the biotransformation of drugs. Drug interactions. Co-administration of multiple drugs can alter liver enzyme activity, leading to unintended consequences. For example, herbal medicines can interact with prescribed medications, affecting their metabolism. Enzyme inhibition and induction. Certain drugs can inhibit or induce metabolic enzymes, altering drug concentrations in the body. Erythromycin, for example, is a CYP3A4 inhibitor that can increase the risk of simvastatin toxicity. Conversely, phenobarbital can enhance the metabolism of other drugs. Genetic variability. Individual differences in the expression of cytochrome, P450 enzymes can lead to variable drug responses. Some individuals may experience no effect due to a lack of enzyme activity, while others may face overdose risks due to hyperactive enzymes. Disease conditions. Conditions affecting the liver, kidneys, or other organs can significantly alter drug metabolism. Infections can also play a role, as they may impact enzyme activity or produce toxins that interfere with drug processing. Hormonal influence, age, and gender. Hormonal levels can affect enzyme activity, and variations in enzyme expression related to age and gender can influence drug metabolism. Dietary factors. Lastly, what we consume can impact metabolic enzyme activity, with certain foods and alcohol having notable effects. 5. Phase Y and Phase 2 reactions. Biotransformation consists of two primary phases. Phase 1. Reactions. These involve the addition or exposure of functional groups on the drug molecule, primarily through oxidation reactions facilitated by cytochrome P450 enzymes. This phase is crucial for both the synthesis and catabolism of various substances in the body. The Phase 2. Reactions. Conjugation. In this phase, the drug or its metabolites are conjugated with endogenous polar compounds, enhancing water solubility for easier excretion. Common conjugation reactions include glucuronide conjugation, sulfate formation, and methylation. Elimination. Definition. The removal of drugs from the body can occur through various routes, including urine, bile, and exhalation. Half-life, T12. The half-life of a drug is the time taken for its concentration to reduce by half in the bloodstream. This metric is essential for determining dosing schedules. Clearance, CLE. This term refers to the volume of blood from which the drug is completely removed per unit time, and is crucial for understanding how quickly a drug is eliminated from the body. 1. Definition of elimination. Elimination is a vital pharmacokinetic process that ensures the removal of drugs from the body, ultimately preventing accumulation and potential toxicity. This process can occur through various routes, which we will discuss in detail. 2. Various routes of elimination. The primary route of elimination for most drugs is through urine, which necessitates that drugs possess natural water solubility or are conjugated to enhance solubility. Urine. Glomerular filtration. Drugs that are unbound can passively excrete through the kidneys, highlighting the importance of protein binding in drug distribution. Tubular secretion. This active transport mechanism allows for the elimination of both free and protein-bound drugs, enhancing the efficiency of renal excretion. Beyond the kidneys, drugs can be eliminated via other routes. Lungs. This route is significant for volatile anesthetics and alcohol, where gases diffuse out of the bloodstream. Bile. Antibiotics and certain other drugs are often eliminated through this pathway, emphasizing the liver's role in drug metabolism. And feces, saliva, and breast milk. These additional routes further illustrate the diverse mechanisms through which drugs can be expelled from the body. 3. Factors influencing renal excretion. Several factors impact renal elimination, including glomerular filtration rate, GFR, a crucial determinant of how quickly drugs are filtered from the blood. Water solubility. Drugs that are more soluble in water are more readily eliminated through urine. Tubular secretion and reabsorption. The balance between secretion and reabsorption determines the overall efficiency of drug elimination. 4. Understanding half-life, T1-2. Half-life is a key concept in pharmacokinetics, representing the time required for the concentration of a drug in the bloodstream to decrease by half. Redistribution half-life reflects changes in drug concentration due to its movement to tissues. Metabolism half-life indicates the decline in drug concentration due to metabolic processes. Achieving a steady state, where the rate of drug administration equals the rate of elimination, typically requires 5 half-lives, as does the elimination of 97% of the drug from the body. 5. Steady state. The steady state is crucial for maintaining effective therapeutic drug levels. Understanding when a drug reaches this state allows healthcare providers to make informed decisions regarding dosing schedules. 6. Clearance, CL. Clearance provides insight into the efficiency of drug elimination from the bloodstream. It is defined as the volume of blood from which the drug is completely removed in a given time frame, expressed in liters per minute. This calculation can be specific to organs or the body as a whole, offering a comprehensive view of pharmacokinetics. 7. First order versus zero order elimination kinetics. Lastly, we must differentiate between first order and zero order kinetics. First order kinetics, characterized by a constant percentage of drug elimination over time, depicted as an exponential decay curve. This is the most common scenario in normal dosing situations. Zero order kinetics occurs when drug metabolism is saturated, leading to a constant rate of elimination regardless of drug concentration. This is often seen in overdose situations and is represented by a linear elimination graph. Thank you for watching the video. If you enjoyed it, don't forget to subscribe to our channel and hit the bell to get updates on new videos. We are excited to share interesting and new content with you, and your subscription helps us keep creating. See you in the next video.